Good afternoon, everybody. Thank you for joining us today. I want to provide you with the latest update on Scotland's response to the COVID-19 epidemic. First of all, I'm able to confirm that as of 9 o'clock this morning, there have been 1,993 positive cases of COVID-19 confirmed in Scotland. That is an increase of 430 since yesterday's figures. It is for me to point out that 108 of those 430 come from one laboratory which was unable to submit data over the weekend. That's part of the reason why the increase that I've just confirmed today is so significant. The increase also, of course, reflects the ongoing expansion of our testing capacity, which I have talked about previously. As of last night, I'm also able to confirm that a total of 135 people were in intensive care with either confirmed or suspected cases of COVID-19. That is an increase of 27 on the figure I reported yesterday. And in total, including those who are in intensive care, there were, as of last night, 1,073 suspected or confirmed cases in hospitals across Scotland. And lastly, it is with sadness that I have to report today a further 13 deaths of patients who had tested positive for COVID-19. That takes the total number of deaths in Scotland now to 60. And again, I want to extend my condolences to everyone who has lost loved ones, and again express my deep appreciation to everyone working in our health and care sector. Everyone across the country is very grateful to all of you for the work that you're doing. As well as having the Chief Medical Officer here today, I'm also joined by Mike Russell, who will talk later about the emergency legislation that we have just published this morning and which will be considered by the Scottish Parliament tomorrow. Amongst other things, that legislation provides for the continuing functioning of the justice system during this emergency period. It also relaxes restrictions for businesses and government in relation to some statutory processes. And as I've covered at this briefing previously, it provides greater protection for tenants, particularly protection against the possibility of being evicted during this crisis period. It is in so many ways an unprecedented response to what is an unprecedented situation. Some of the provisions in this bill are of a type that I would never have wanted or expected to be introducing to Parliament, and we will ensure that these provisions do not remain in force any longer than is absolutely necessary. But it is worth highlighting, and Mike Russell will say a bit more about this, that these proposals have been developed in discussion with opposition parties, and that cross-party approach is one that we are determined to continue for any future emergency legislation that might be required during this period. I want today to briefly highlight 4 other issues before handing over to the Chief Medical Officer. Firstly, I want to update on the situation in relation to delayed discharges, where people who are well enough to leave hospital can't do so because care arrangements for them are not in place. At the outset of this epidemic, we set a target of reducing cases of delayed discharge by at least 400 or 25% from the baseline as of the 4th of March. Current figures indicate that we have achieved that, and delayed discharge cases have now been reduced by more than 400, and we are now aiming to reduce numbers even further during April. This reduction is, of course, good in itself. People should not be in hospital for any longer than they need to be. But it is, in this context, particularly important as part of our effort to increase NHS hospital capacity as we start seeing more cases of COVID-19. I also want to update briefly on NHS staffing figures. Yesterday at the briefing we were asked about the numbers of NHS workers off sick right now because of the virus, and I'm able to confirm that at present just over 6% of NHS staff are off work either with COVID-related symptoms or self-isolating because somebody in their household has these symptoms. That number is relatively low, and it's important to be very clear that we would expect to see that number rise in the weeks to come. But it's also important to note that we have now begun testing of key workers, and as we continue to expand that capacity, we will be able to get people back to work as quickly as possible. I also want briefly to comment on the announcement we made yesterday on early education and childcare. Local authorities were on track to implement their new duty from August this year of providing 1,140 hours of free childcare a year to all 3 and 4-year-olds and to 2-year-olds who would benefit from it most. In fact, more than 50,000 children were already benefiting from that expansion. It is, however, clear that this emergency makes it impossible for some local authorities to meet that target by August. The emergency is already having a major impact on both recruitment drives and construction work, so we are therefore no longer imposing a statutory duty on local authorities from August, but I want to make absolutely clear today that we remain committed to ensuring that this expansion happens as soon as possible. It is one of the most important policies and priorities of this government, and one that we will resume working towards as soon as we possibly can. The final issue I want to touch on today relates to the £350 million Communities Fund, which was announced in Parliament 2 weeks ago. Money from that fund is already being allocated to organisations across the country, and today we are confirming that more than £1.5 million will be given to Scottish Women's Aid and Rape Crisis Scotland. There is, as I think everybody understands, a real risk that women and children who are already subject to domestic abuse will feel even more isolated and vulnerable during this crisis. So this funding will help to ensure that they have access to support services. In fact, I want to ensure that people know that the Domestic Abuse and Forced Marriage Helpline remains fully operational at all hours during this epidemic. Anyone who needs support or advice can email or web chat through their website, or you can call them on 0800 027 1234. The key message that I want to convey today is this: people who are suffering domestic abuse do not have to wait to seek help. That help is available now, and you should not hesitate to come forward and get it. I will pass on to the Chief Medical Officer in a moment and then to the Cabinet Secretary, but I want to end by restating the most important message of all. As updates like these demonstrate, the Government is working on a wide range of fronts to support the NHS and other parts of the economy and society, and to deal with the many and varied impacts of COVID-19. But it remains the case that the most important actions in dealing with this virus are the ones that each and every one of us can take. By staying at home, by limiting contact with other people as much as possible, every single one of you, every single one of us is doing our bit to slow the spread of this disease, to protect our NHS, make sure it is not overwhelmed, and ultimately to save lives. I very much hope that it will not be too long before we are standing here at one of these briefings talking about the slowing down of this virus. But we are not yet at that stage. And when we do reach that stage, it will only be because people have been doing the right thing by staying at home. So I end today by asking everybody across the country to stick with it. Thank you for doing so, because by doing so, by following this advice, you are helping us to save lives. Chief Medical Officer, would you like to add a few words?
Thank you very much, First Minister. I was going to add to those words of encouraging everyone to continue to stay at home and avoid contact with people outside your own household as much as possible. Whilst there have been more tests done in the past few days as we increase our capacity for testing, and this has allowed us to start to test some key workers in health and social care to allow them to go back to work if they do not have coronavirus or someone they're isolating with does not have coronavirus. But the increased number in positive cases in Scotland today is not simply because we are testing more people. The proportion of those tests which are positive is increasing day by day. This shows us that within Scotland at the moment, despite how well people are complying with the measures, despite the stringency of those measures we've put on the population and asked them to do these very difficult and restricting their behaviours, our numbers of cases every day in Scotland to continue to increase. So the proportion of people who are we are seeing is increasing day by day, even with these measures in place. Obviously, we don't know how fast it would increase without these measures, but I want to emphasise that despite what we're doing, the virus is still being transmitted in our communities. The only group of people that we're not seeing sustained transmission in is amongst people under the age of 15. This is in common with other countries around the world where we think that children and younger people are not either seriously affected by the virus or perhaps don't get it at all. But in all other age groups across our Scottish population, the number of people catching this virus continues to increase. The measures we're taking will help, it will slow the transmission, and I can only thank people for all that they're doing to protect our NHS and to protect our Scottish population.
Okay, thank you, Catherine. Can I hand over now to Mike Russell?
Thank you, First Minister. The emergency bill, as the First Minister said, that we're publishing today is necessary because we are in an emergency, and it requires all the efforts of government at every level to meet that emergency, working, of course, with citizens, as the Chief Medical Officer and the First Minister have said, who have a huge role to play. This bill has been developed with the opposition parties, and we will continue to work very closely across politics in order to ensure that everybody knows what is taking place, everybody can influence what is taking place, and everyone can also influence when we stop using these measures, because these measures are designed for one purpose only, and that is to make sure that government can continue to operate and that citizens can stay safe. The bill has quite a number of provisions within it, and I'm very grateful to those who have brought it together in a record-breaking period of time. For many people, the provision in it that means that rental there's no possibility of people being evicted for not paying rent is central to the bill, and that will be explained in greater detail tomorrow. But people require to be safe in their homes. The bill also deals with a range of issues in the criminal justice system where it is absolutely essential that we have the provisions necessary to continue the administration of justice. And the bill tackles some comparatively small but really important issues in government where we have to ensure that the business of government continues, even if people cannot meet and cannot meet together to do certain things, such as sign documents or make depositions. All those matters are in the bill. The bill will, we hope, go through in a single day in the Scottish Parliament tomorrow through a truncated process, and we will be working very hard and continue to work very hard across the Parliament to make that happen. This will not be the final measures in legislation, because there are more measures that will need to be looked at in the weeks ahead. But I want to make an absolute commitment that this bill, which is renewable only twice at 6 monthly intervals, will not be renewed if we do not need it. As the First Minister said, nobody wants to be in a position of putting these measures in place. We want to make sure they are no longer in place just at the moment when they are not needed, but they are needed now. We will also report comprehensively on the bill to Parliament and to a wider public. Every 2 months we will say how the provisions in this bill have been used. We'll make sure that they are subject to scrutiny as they should be.
Okay, thank you, Mike. I'm now going to go to journalists who are joining us remotely today to take a series of questions. I have a total of 19 journalists who've indicated they want to ask a question. I want to get through all of them, so we'll try to be as brief as possible. But can I ask journalists, if your question has already been asked, then don't feel the need to ask it again. If there are other questions you want to ask, of course, you're free to do so. But I will firstly go to Sarah Smith from BBC Network.
Get my microphone on. Oh, crumbs.
We can hear you.
How do I? Oh, excellent. Okay. So let me ask you, First Minister. You'll know there have been concerns already expressed about UK-wide measures being too draconian. Are you concerned about being the First Minister who brings in some of these emergency powers? And can you guarantee that they will all, every single one of them, be repealed as soon as possible? And when might that be?
Well, I've said a number of times, and I will say again, that I did not ever anticipate or expect or want to be a First Minister standing here announcing some of the things that I've done over the past few weeks, from closure of schools to asking everybody to stay at home apart from essential reasons to go out, through to some of the powers that we are now taking, powers that were passed in the UK legislation last week, and these powers that we will ask the Scottish Parliament to pass tomorrow. But I judge all of these steps to be necessary to limit and reduce the impact of this virus. I can give an absolute assurance that none of these powers will stay on the statute book any longer than is necessary. I cannot say at the moment, given the uncertainties of this virus and how long some of these measures will require to be in place, exactly what that timescale is. But as Mike Russell has just said, we are building into the legislation clear points of scrutiny and clear obligations on the government to report to Parliament on how these are used, and we will continue to work on a cross-party basis. I am absolutely determined that we do everything we can to fulfil the objectives of slowing the spread, protecting the ability of our NHS to treat people, and ultimately to save lives. I don't underestimate the damage to the economy that's been done right now. I don't underestimate the impact of restricting people's liberties in the way that we are doing right now. But all of these things, however difficult, we can repair and get back to normal on. What we can't do is bring people back to life. And that's why the absolute focus here must be on reducing, as far as we possibly can, the numbers of people who die from this virus. Can I now go to Peter McMahon at ITV Borders?
First Minister, my colleague at ITV Wales interviewed Mark Drakeford, the First Minister of Wales, who said that both you and he and your colleagues from Northern Ireland had argued for stronger action on construction sites at Monday's Cobra. I just wondered if that's true, and given the intervention today by Douglas Ross, the junior minister in the Scotland office, who says their advice is that some construction can go ahead, is there further scope for cross-border confusion on something that's vitally important?
Well, in terms of Mark Drakeford's comments about the Cobra meeting, which was a week past Monday, so not yesterday, but last Monday, yes, there was a discussion. I think Sadiq Khan, the Mayor of London, has already talked about this as well, where there was a difference of opinion about construction. And you will have these differences of opinion from time to time. And I'm absolutely clear that I don't want to be in the position of criticising the decisions and the judgments that other leaders are taking. We're all trying to do the very best for the people we serve in exceptionally difficult circumstances. But my judgment on construction is that apart from construction that is really essential, for example, construction work on hospitals or construction work that is required to help us with the fight against coronavirus, it is not clear to me that non-essential construction can continue as normal in a way that protects people's health. In other words, with safe social distancing measures being applied. And therefore, if I can't be sure about that, then the judgment I reach is a precautionary one. How do we make sure that we are taking the action we need to take to maximise our ability to save lives, reduce the number of people who die? And that's the judgment I have reached. Most construction companies, as far as I am aware in Scotland, are complying with that. I've seen quotations from Sir Robert McAlpine, who operates across the UK. That company has ceased its activities, certainly non-essential activities here in Scotland. And I would repeat the point I made in response to Sarah. The economic impact of what we are doing right now is significant. It is going to take time, effort and resources to repair the economic damage once we're on the other side of this virus. But I say what I said a moment ago. We can repair that. We can't bring people back to life. And therefore, my view is that the priority in everything we do has to be to preserve, as far as we can, human life and reduce the number of people who die. And that is what all of the judgments that I'm taking, advised by the Chief Medical Officer and others, that's what all of these judgments are about. And I will now call on Kieran Jenkins from Channel 4.
We've seen a survey of home carers in part of Scotland, First Minister. 85% say they don't feel safe or supported by their council. One home carer told us to tell you she is scared. It suggests that something's not quite right. What do you think that is?
I've not seen your survey, Kieran. I'd be very interested to look at it. But even without seeing that, I know how difficult this is for home carers. I know how difficult this is for the social care sector in particular. And we are working extremely hard with local authorities, with voluntary organisations, with the request for volunteers that we have launched in the last few days to make sure that we are putting in place at local level the kind of arrangements that can support those who are most vulnerable and those who need that support. So, you know, we've talked previously about the around 200,000 people in Scotland who are in the most vulnerable category, who are in the process right now of receiving letters from the Chief Medical Officer telling them that they have to do the most extreme form of isolation. We are putting in place arrangements led very much by local effort to make sure that they are properly cared for and looked after. That includes food and medicines delivery where required. But there are a broader range of people, some of whom will have home care, some of whom will have care in other forms that we also need to make sure are getting the support, advice and care that they need. So there is a huge amount of work going into that, and we will continue to listen to the views that people express to us, to look at ways in which we can support that, to look at ways in which we can provide extra effort to support the work that frontline carers and health service workers are doing. So this will be ongoing. I don't think we will ever get to a point during this epidemic where we can sit back and say that we are doing everything we need to do. It is something that we have a daily focus on making sure that we are taking all the steps that are required of us. Lisa Summers from BBC Scotland.
Hi, yes. We've seen figures today from the Office of National Statistics that suggest that the number of community COVID-19 deaths are not reflected in the official statistics. Do you believe that in Scotland, the actual number of deaths is an underestimate because we are not necessarily recording people if they're not admitted to hospital with COVID-19?
Well, thanks, Lisa. Let me try and take this question in a bit of detail, because I think it's important people both understand what is being reported now, but also the work that is underway in Scotland to make sure that as this epidemic develops, the figure that we are releasing and is being published for the numbers of people who die is an accurate one and one that is robust. So firstly, Health Protection Scotland do not consider that the figure we're publishing at this stage is a significant underestimate. The HPS, the Health Protection Scotland figure for the numbers of death that is reported right now, it reports deaths in individuals within 28 days of a lab confirmation of COVID-19, and that is irrespective of the location of the confirmed case. National Records for Scotland, their death registration statistics will cover all deaths regardless of setting where there is a mention of COVID-19 on someone's death certificate. Now, the work that is underway right now and will develop in the next few days is to link up both of those sources of information, the HPS figures and the NRS figures, so that as we move forward and as this epidemic develops, particularly in the community, then between those two sources of information, there is a robust figure for the numbers of deaths being reported in the future. So we will keep you updated as that work develops. I'll turn to the CMO at this stage, just in case there is anything she wants to add to that.
Thanks for your question, Lisa. It's correct to say that at the moment we believe that if there is an underestimate of deaths, that this is not significant because we have not got significant transmission within the community where people are becoming very unwell and dying without being admitted to hospital. We have talked with HPS. I talked to them this morning, and we will combine these pieces of data that First Minister's described. So we will be describing presumed positive cases which have led to death, which will be mostly in the community, and also these confirmed laboratory cases, which is what HPS is currently reporting on.
Okay, thank you. Ross Gubbins from STV.
Yes, can I move to the emergency legislation going through Parliament this afternoon? Is there provision for some prisoners to be released early from their sentence? And if so, what safeguards and checks have been put in place to ensure their victims are safe and don't feel threatened?
I'm going to hand over to Mike Russell. That provision is in the bill. I just want to stress for the assurance of people across the country that that is a power that we would only use as a last resort. It is not something we want to be in a position of doing, but as is the case with many of these powers, they are there as a contingency so that we have them should we need them. But Mike, do you want to go into a bit more detail?
Yes, can I stress that this would require further action by the Scottish Parliament to approve regulations for release. So this is a two-stage process, and there are a number of processes in the bill that would be the case. The legislation also specifically excludes certain categories. Life sentences, those who are convicted of sexual crimes, there are a number of categories within the bill. As the First Minister said, this is not saying that this action is going to take place, but is creating the circumstances in which it could take place if there was, for example, a substantial increase in the cases within the prison service. This will be kept under review, and of course we will make it clear if the power is going to be used before it is used. The procedure will be to put those regulations into the Parliament. They have to be approved within 28 days, but they can come into effect immediately. So it's a potential, but it's not an actuality as yet.
Okay, thank you. I have Alan Smith from Bauer.
Hi, good afternoon. The STUC has issued a call today for additional guidance on essential business activity, particularly for manufacturing, food and drink and construction. This is becoming more urgent by the day, and that some employers are continuing to play fast and loose with the concept of what is essential. Given that this guidance has been in place now for nearly 2 weeks, is it now time for the Scottish Government to issue even more detailed guidance on what is essential?
So we are looking at whether we can issue more guidance that clarifies even further the do's and don'ts and the principles that we're asking businesses to follow. So we will obviously look carefully at what the STUC thinks is required, and if we think there is a need for, and if it would be helpful to have further guidance, we will certainly do that. But I want to be clear today that there is guidance in place. In my view, and based on the information I have, the vast majority of employers are paying heed to that, but that guidance is on a precautionary basis. So there are a number of businesses that are being told categorically to close, pubs and restaurants and non-essential shops, for example. At the other end of that spectrum, there are businesses that are essential to the critical infrastructure of the country to keep the lights on and the food supplies moving, and we understand that they have to remain operational. Between those two ends of the spectrum, we have put in place guidance that says that there are things businesses should be paying attention to. You know, is what they're doing material to the well-being of the country, either the fight against the virus or more generally? If so, can they allow workers to work from home? If that's the case, they should do that. And if not, if they can't allow people to work from home, can they ensure safe social distancing practices and, of course, comply with other health and safety requirements? Now, we've been very clear. If the answer to any of those questions is no, then they should not be operating as normal. And yes, we'll look at whether there is a need for further guidance, but I don't want anybody to be under any doubt about the guidance that is already there, because while it might not give you a bespoke answer for every single business in every single sector, it gives very clear principles that businesses should be having regard to. And I come back to the precautionary point. If you're in any doubt at all at this stage, and this applies to businesses as it does to individuals, then err on the side of protecting public health and protecting people's lives. Can I go now to Greg Flucker from Wave FM?
Thanks. My question for you is, the NHS Tayside has revealed around 16% of staff tested for the virus have come back positive. How sustainable will it be for the health service if that figure rises in line with an increase in diagnosis?
Well, we expect to see the numbers in our health service and social care sector, just as we would expect to see numbers across the economy more generally who are off work because they have this virus increase as the spread of the virus increases. But as we roll out testing, as we're able to test more people, then what we will want to be able to do is ensure that those in the front line of our health service are not having to isolate when they don't have the virus, and of course they're able to get back to work as quickly as possible. But we do, our planning in terms of capacity for the NHS and care sector has always assumed that there will be a number of people, a percentage of people who are off work at any given time because of the virus. Catherine, do you want to add anything?
Thank you. I think it's important to remember that the primary criteria for testing is that somebody has symptoms suggestive of coronavirus. So we would only be testing those healthcare workers who are coming forward with symptoms themselves. So it does not surprise me that a very significant proportion of those people are testing positive for coronavirus. And we will find that that proportion increases with time rather than decreasing. The important thing is that those people then are taken stepped away from the workforce so that they are not then infecting or transmitting the virus. Once they're well and have no more symptoms, they can safely go back and in fact will have antibodies which means that they are in fact safe from their own health point of view to be treating patients who have coronavirus and are hospitalised with that.
Thank you. Jack Foster from Global.
Good afternoon, First Minister. We're aware of plans to build temporary hospitals in Scotland, most likely at the SEC in Glasgow. But I was wondering, what else is the government planning to increase the capacity of the NHS in Scotland during this crisis? For example, we're aware of moves across the rest of the UK to partner, in inverted commas, with private healthcare providers, and hearing similar things from other countries. Scotland's position seems a bit less clear on that just now. Does the Scottish Government intend to strike a deal with, or for want of a better term, commandeer private health facilities in order to increase capacity?
Yes, we have plans already in place to use any private sector capacity that is there in Scotland. What I would say, and I think people are aware of this, there are fewer private sector beds available in Scotland than elsewhere in the UK because our private health sector is smaller, but we will use that capacity should we need it. Very briefly, we have set out plans already to secure within our existing hospital network 3,000 hospital beds that are available for COVID-19 patients. Now, we are doing that partly by suspending non-urgent elective treatment, by reducing delayed discharge, which I've spoken about already today. And as we announced yesterday, we are going ahead with plans to create a temporary hospital at the Exhibition Centre in Glasgow, starting with a capacity of 300, but with the ability to go up to over 1,000 should we need it. Now, right now, we're not saying we will definitely need that because the capacity we're creating within the health service should be sufficient, but we want to have as much contingency as possible. Just to put this in context, I've just given you a figure of just over 1,000 people right now who are in hospital because of the virus, including those that are in intensive care. And without even having the temporary hospital, we have plans for a capacity of 3,000 beds. So we're doing everything that we reasonably can to make sure that we have the capacity that we will need to meet the demand that comes from this. But finally, people can help us reduce that demand if they keep following the advice that we're asking them to. Katrine Bussey from PA.
My question was actually about the release of prisoners, so it has, I think, been covered.
Excellent, well done, Katrina. I think you've set an example there to be followed by others. Michael Blackley from the Daily Mail.
Good afternoon. Just to return to the emergency legislation, I'd like to ask about the trials that will be taking place without jury, which would usually have jury. Do you have any concerns with them that there could be an increased potential for miscarriages of justice?
No, I don't. There are many countries where serious crimes are taken through the courts without juries. I'm a believer in the jury system, I should add, but this is an exceptional measure to deal with exceptional times, at a time when for good health reasons, juries are not being impanelled right now, then the alternative is not to have cases proceed, and therefore to have provision for cases to proceed in this way, I think is sensible. Do you want to add briefly, Mike?
Just to make it clear that quite clearly the Lord President has asked publicly for these powers. These powers will be in place only as long as they are required. But they are required now if we're not to have a totally unacceptable backlog in terms of cases, and also if we're not to have a situation where individuals have to wait a very, very long time indeed. We have looked at the practicalities of remote juries. It simply isn't practical at this stage, but as we continue to look at it, we may be able to bring forward other ideas.
Thank you. Simon Johnson from The Telegraph.
Hi, First Minister. I just wanted a bit more information on the temporary release of prisoners. Can you say a bit more about the process that prison governors would have to follow to initiate the temporary release of some of their inmates? And potentially, if the virus was widespread within their prisons, would they have the ability to, for example, empty an entire wing?
I'll hand over to Mike Russell on the detail of that. I just want to emphasise again, though, that this power we would only use in a last resort. So I want people to be clear that this is not something that we will do lightly, and hopefully will not require to do at all.
Yes, in terms of the role of prison governors, the bill explicitly states the prisoner is not to be released if the prison governor believes that they would pose an immediate risk of harm to an identified person. And that adds to the fact that those serving life sentences, terrorists, those convicted of sexual offences will not be eligible for release under the bill. So there are very strong safeguards. And I'd also stress, again with you, Simon, this is a power. It is not actually a power that can be used without regulations. Those regulations can be further developed. But of course, it would depend upon the actual need that took place. And of course, the prison governor, working with the prison service, working with the Cabinet Secretary of Justice, working with the First Minister, will come to a conclusion, if it is required, to use this power. But we are not at that stage, but the power has to be there in case it is needed.
Vivian Aitken from the Daily Record.
Sorry, could you give us any further indication of the areas that the emergency powers will cover?
Mike, briefly, do you want to run through some of them?
The
legislation is published, so you can go on and look at it as well.
There are a very substantial number of powers, but let me put them in 3 areas. There are the legal powers, which consist of matters such as the juries, such as the release of prisoners, but there are a range of others, including the way in which evidence can be given in court remotely, and also issues about signing of documents. There are issues within property, and particularly within tenants' relationships. This is the start of a process. We're able to deal with most tenancies in this, but there are other tenancies, for example, possibly in the agricultural sector and in tied houses, we will still have to deal with. But this means that the vast majority of people who are tenants would not be subject to eviction. There are a range of issues within the public sector. Some of them are comparatively small. Some are very significant. For example, licensing in local authorities. We don't want taxi licenses to expire and be unable to be renewed. There are issues, for example, in planning permission, which would otherwise lapse. There are that type of issue. And then there are the issues which I referred to in terms of how we take this bill forward, how parts of the bill can be switched on and off, how the bill can be renewed, and particularly how it is reported on, so that this is absolutely transparent. And I'll be taking forward the issue of reporting so that we are doing it very clearly, very transparently, very fully with all the relevant ministers.
Okay, Mark McLaughlin from The Times.
The Sunday Times reported that you've now been locked out of Cobra decision-making as UK ministers and officials try to cover their backs from recriminations for the swiftly abandoned gradual herd immunity strategy. The question is, does that reflect your experience of Cobra? How invested were you in that gradual herd immunity strategy? And given it was swiftly abandoned, how confident can we be that your current strategy of surveillance testing at a level below that recommended by the World Health Organization will keep deaths from spiralling to levels seen in Italy?
Very briefly, there's a range of questions there. It's not really my sense of or how I feel about the Cobra process. I think that's been a helpful process, one that Scotland has been able to participate in. And just generally, I've got no interest at all in party political or intergovernmental bickering in this. You know, there are many issues that will happen on, but this should not be one of them. But what I'm really clear on, and have been clear since day one as First Minister, as somebody that's not a doctor or a scientist, that I want to do my very best and apply my best judgment to the scientific and expert advice that I'm getting. I'm in a very fortunate position of having very good, strong advice here. And while I think it is right that we have a four nations approach, this virus doesn't respect borders or boundaries. Where there are issues that I believe we need to do something in Scotland, even if the other countries are not doing it, I will not hesitate to do that if I think it is meeting the objective of slowing the virus and saving lives. And you know, I think the comment in the Sunday Times was in relation to closure of schools. On the day that I announced the closure of schools, the advice I had, both from a health perspective but also from a practical perspective, said that that was the right moment to do that. So my duty as First Minister is to the people of Scotland, and I try to do that duty to the very best of my ability, taking on board the advice that I have. And I will also not shy away from saying, if this is the case, at any point that we are changing position, because the advice as we learn more about this virus has changed as well. None of us have all the answers here. None of us have been in this situation before. We will all get things wrong. We will all make mistakes, but I will continue to try to take the right decisions based on the best judgment and absolutely in good faith. And I believe that's what the Prime Minister is doing, and I believe that is what the other First Ministers are doing as well. And if occasionally that takes us to different positions, it will be because of those reasons. Gina Davidson from The Scotsman.
Hi, thanks, First Minister. You've announced money today for Women's AIDS and Rape Crisis Scotland. I just wondered, do you think more needs to be done given the spikes that we've seen in domestic violence in other countries, China and so on, while lockdown has been in place? And is there a role for Police Scotland to maybe be being proactive in visiting homes that they've been to in the past 12 to 18 months, perhaps?
Yes, I think there is a need to keep a very, very close eye on this. I know the police, and it's not for me to tell the police on an operational basis what they should be doing and how they should be doing it, but the police have already said this is something that they are very conscious of and will be very vigilant around. I don't think it takes too long for any of us to think about this and understand the increased risks and vulnerabilities that many women and children will be in as people are living more of their lives behind closed doors. So we will continue to look at the resources and the funding that frontline organisations have, and if we think there's a case for increasing that, we will not hesitate to do that. But I want to stress again today to anybody watching here who feels they need advice and support, don't think that because of this emergency situation that advice and support is not there. It is there, and I'll repeat the number: 0800 027 1234. Tom Peterkin from the P&J.
Good afternoon, First Minister. Is the Scottish Government willing to support Loganair given the difficulties it's experiencing and the fact that it provides lifeline services to islands amongst other places? And is there a contingency plan if the worst should happen and the company folds?
We have been working closely with Loganair to make sure that we are protecting essential services from our islands to the mainland, and also making sure that there are services there for emergency purposes. So those discussions with Loganair continue, and we will do everything we can to make sure that the company is supported. Libby Brooks from The Guardian.
Hello, First Minister. The Scottish Criminal Bar Association has described the measures around juries as premature, disproportionate and ill-advised, and I was wondering if you could offer them some reassurance and also just sort of clarify what the trigger would be for complete suspension.
Well, obviously, we're not deaf or blind to the concerns around these powers. I come back to my starting point. I would never have wanted to be in a position of passing legislation like this. We wouldn't be doing it if we didn't think it was necessary for the protection of the population. As Mike Russell has already said, the Lord President has asked for these powers because the alternative right now, if we have a situation where for health reasons we cannot have juries impanelled, then the alternative to this kind of arrangement is that we don't have trials proceeding. Many trials, summary trials of course, happen already without juries, so this is an exceptional circumstance for an exceptional situation, and is not something that we would want to remain the case for any longer than is necessary. Do you want to add anything?
Simply to say that, of course, we're listening to all those who are involved, but there is no alternative at the present moment if the administration of justice is to move forward. That's, to be say, the view of the Lord President and the Lord Advocate. But of course, we want to make sure that in the courts people remain safe. So the regulations within the courts, social distancing of the court has to be part of this as well, so that everybody can remain safe. And that is the purpose, as well as the administration of justice, to keep people safe.
Tom Martin from The Express.
Good afternoon, First Minister. Just to ask, in terms of the increase in the number of cases we're seeing, have any clusters been identified yet? And in what sort of settings or locations might that be?
Well, the breakdown of that number will be published as usual at 2 o'clock today, so shortly, but I'll hand over to the Chief Medical Officer in case she wants to say anything about the number that's been confirmed today.
Thank you. We are seeing more in some of our health boards than others. It is apparent that in Greater Glasgow and Clyde, for example, which has a much larger population, that there are an increased number of cases there. That's not anything other than we would expect. We haven't identified individual clusters that are causing us any particular concern on a geographical area basis.
Okay, thank you. And penultimate question from Alistair Grant at the Herald.
Hi there. There are reports today that planning for the Edinburgh Festival Fringe is expected to be officially suspended from tomorrow, and Edinburgh's other summer festivals, including the International Festival and the Tattoo, are expected to follow suit. Has the Scottish Government been involved in any discussions around suspending preparations? And what is the latest on that?
Well, Fiona Hislop, as Culture Secretary, has been engaged in discussions with cultural organisations, including, I understand, the festivals, but this would be a decision for them, and not just a decision for them to take, but a decision for them to announce should that be their decision. So I think I will leave it to the festivals to set out their own intentions in their own timescale. And lastly, Chris Musson from The Sun.
Hi, the World Health Organization has obviously urged test, which we don't seem to be doing. Do you intend at some point to test the general population, perhaps randomly, not just ill people at the GPs under the surveillance scheme? And if not, how will we know how many people have had COVID-19, and therefore how will we know the true mortality rate and when we can, return to normal?
So we are significantly increasing our testing capacity. That's an ongoing process, and you can see in the numbers today that that process is underway. We've set 3 objectives for our testing: to support the care of those who are most seriously ill, to support frontline health workers get back to work and stay at work as much as possible, and thirdly, surveillance, which will be able to tell us a lot about how the virus is spreading and operating. Slightly longer term, although we don't yet know exactly how long term, we're talking here the possibility of antibody tests as opposed to diagnostic tests in future that will be potentially able to tell us who has had the virus and who hasn't. And I'll hand to the Chief Medical Officer to say a bit more about that, as well as testing in general.
So it's important to understand that the tests we have at the moment are for people with symptoms. You have to have a certain amount of virus at viral load in your system before that test would be positive. So it would be completely inappropriate to test people at random. The first criteria, as I've said already this afternoon, is that people should have symptoms that are suggestive of coronavirus. As that capacity to test more people expands, we will widen that to more groups of key workers in particular, but also our community surveillance is being increased all the time. Our community hubs in primary care, which started this week, are going to be testing 100 people a day across Scotland from different age categories. And those numbers will be used then to extrapolate to the general population, so that we will have a breakdown of the numbers of people across different age groups across Scotland as a whole. The capacity will increase further from the 1,900 tests that are available today to 3,000 to 4,000 tests. And then when some more commercial testing comes into play, as we've said before, we will be able to test many more people. But again, that testing, that diagnostic testing, is for people with symptoms.
Okay, thank you. That is the questions completed. Can I thank all the journalists for joining us today, and thank everybody at home who has been watching. We'll see you again. We will have statements in Parliament tomorrow rather than in here, but we'll see you again here later on in the week.